much too.
Oh no. All right, we are officially live. Thank you so much to everyone who is tuning in live right now or is watching the recording later. So we'd like to welcome everyone to the special episode of the Power Panel. Before we dive in, we would like to talk about, who is sponsoring today's panel. So we have MYOS MD. It is a cutting-edge nutritional supplement designed to combat muscle loss and support healthier aging. Powered by Fortetropin, which is a natural bioactive compound clinically shown to enhance muscle growth and reduce anabolic resistance, MYOS MD is changing the way we think about muscle health. If you'd like to learn more about MYOS MD, you can go to the website myosmd.com. All right, so to today's episode, we have an exciting guest, Dr. Leandro Pucci. So if you could please give a little background on yourself, particularly, your clinical background, and then we can dive into the topic at hand.
Hi, nice to meet you. So, yes, I am a doctor of clinical nutrition, and I focus on the functional medicine aspect of health, seeing the body as a set of interconnected systems interacting with each other and with the environment. And I specialize on metabolic optimization using low-carb diets. And on top of that, I specialize in working with men because we tend not to look for help when we have any health concerns until, things get into a certain level. And so that's what I love to do, helping men to fix their, especially lifestyle-related chronic conditions and enhance their cognitive and athletic performance. Some of these men that I see are very much involved in exercise and these kind of things. So that's the basics of what I do.
That's great. So yeah, let's dive into that. So what are some of the most common yet perhaps overlooked warning signs of metabolic dysfunction in men?
Well, the first easy one to observable is adiposity, especially where the excess fat is located, especially the belly fat. Some people call it the beer belly. So that is a great primary indicator. When we tend to accumulate adiposity in the belly, that could be very an indicator of hormonal issues, especially insulin resistance. Then, of course, there are labs that you can see. Most people get very concerned when they get some numbers in their triglycerides or HDL that are mostly overlooked in regular medicine. They usually look at LDL, but triglycerides and HDL, the ratio of triglycerides and HDL is a major indicator also of insulin resistance. Of course, fatigue, energy, crashes, you know, some people complain of being tired, but it's beyond that. It's something that no matter how much you sleep, how much supplements you do, or how much you take care of yourself, you seem to be in that hole all the time. That is also an indicator of possible insulin issues. Problems with concentration, the famous brain fog. Those are also symptoms of this kind of dysregulation. And a major one that it's happening more and more in younger guys, erectile dysfunction. It's a major indicator of metabolic dysregulation. Not sleeping well, either by choice or our hormones are so out of place that it's difficult to fall asleep, maintain sleep, and that is also indicator of hormonal dysregulation. And of course, one that is kind of hidden because seldom is measured in the lab is your levels of insulin. Sometimes our glucose levels in the blood are okay, but we're not looking beyond because pancreas may be working overtime just to keep that glucose unchecked. But the pancreas working overtime for a long time eventually is going to just give up. And that's how diabetes are happening. Well, we want to prevent that.
Right. And we know that muscle mass is a strong predictor of longevity. So, how do you frame the importance of preserving muscle in your male patients, particularly for those that are in their midlife or beyond?
Well, the more muscle you have, the better you are at utilizing and storing glucose
Mm.
in the muscle instead of fat. So that's a big goal to have. Greater muscle mass improves insulin sensitivity and helps regulate blood sugar, and hence reducing the risk of diabetes and other metabolic diseases. And when I say metabolic diseases, it's everything because when something is not working right in the body, so metabolic function is not working, and you can consider blood pressure, brain fog, all those things are related to metabolic condition. Also, resistance training is super beneficial for bone density, bone health. When you do heavy resistance training, you're challenging your bones to uh, just grow, and that's uh, rotation or the how do you call it, the revitalizing of the bone to be continued as we age instead of becoming, instead of losing more bone, you're regenerating the bone. And then, of course, when you are strong, healthy, able, you have independence. You can move around, you can jump, you can walk, climb stairs, and do all that, and prevent, falls and things like that. And then, of course, in general, having a good muscle density will reduce your risk of chronic diseases, you know, and help with your chronic cognitive function as well, especially because exercise produces or the excretion of myokines that influence the brain function.
Absolutely. And so, as we're thinking about muscle health and longevity, let's talk about protein. I know everyone is talking about protein. All these brands are trying to incorporate more protein into their products. So, how does protein intake and, in particular, protein quality factor into this discussion, especially when you're making clinical recommendations to your patients?
Well, this is a big topic that we're talking about, and the big misconception and the big reprogramming that a person like me is doing with everybody. We don't understand. Protein is the foundation of life. I just tell people, look at you. What is this? Protein. And then internally, our DNA, our operating system is just functions of protein, all of that, hormones, any cellular function, cellular messaging, all of that is based on protein. So, and in general, the RDA's recommendations are so low that we have been missing that. And the major problem that people have trying to lose weight and they're not eating enough protein, that's the main cause. Lack of protein. I think we need to start thinking of a range of eating protein between 1.6 and 2.2 grams of protein per, I call it ideal body weight. Some people try to pursue a number, which is not a good idea either, because the body goes where it wants to go. And if you're also doing heavy training, exercise, muscle weights. So you may not be at that ideal weight. So more calculating more the amount of protein as a general form, it would be more beneficial. Also, we need to emphasize on intaking the complete protein, essential amino acids, uh, particularly leucine for muscle growth. The best sources of that will be animal protein, always. I always tell people eggs are nature's protein bar. Cheap, not these days too much, but still is the best source of protein. When in doubt, add an egg. And then also the time of when you take that, when you eat that protein. So it should be more or less steady during the day. I always recommend having when creating your plate, no matter the size of it, big or small, just visually about half of it should be a protein based uh, content. And then the more protein you have, the less hungry you are over time. So that's a major plus.
Yes, definitely. What do you say to people who are afraid of eggs or they think that, oh, eggs have too much cholesterol? What's your reframe when people say that?
It's still getting that. Well, we don't absorb cholesterol from foods that much. Cholesterol, I see it, but first, cholesterol is anti-inflammatory. Uh, and all our hormones are made of cholesterol. The body, the liver is the one producing cholesterol. Um, so don't be afraid of cholesterol in the food because we don't absorb much of that. When there's an unbalance in your lipids, we need to look somewhere else. It's something else happening. It's an inflammatory process going on somewhere else. So that is just a symptom when we have some lipid disturbances. But no, eating cholesterol doesn't increase your cholesterol in general. There's always, in nutrition, I always say nothing is a definite, nothing is black or white. But in general, that's the consensus.
Yeah, I agree. The other thing I wanted to ask you about in regards to your previous answer is you mentioned ideal body weight, and sometimes people want to have, a different weight than might be their ideal body weight. So how do you arrive to, what is the ideal body weight for a particular patient?
Oh, that's easy. I always tell people your ideal body weight is when the mirror is telling you that you are where you are, you feel happy, your brain is functioning, you have freedom of movement, you can do whatever you want, you last throughout the day, and you're basically happy and functioning. You can be 300 pounds, sample, uh, and everything looks great, and your numbers are great, and everything. Who cares how much you weigh as long as your metabolic health functions? Which is not the same. This is the big discussion of um, body shaming or healthy at any weight. There is a difference between healthy at any weight and being obese and metabolically unhealthy. So that's the big difference. Especially ladies, they want to say, I want to be 150 pounds, and they haven't exercised in their lives. And suddenly they start eating more protein and they start lifting weights. And some of them become enamored with lifting weights and they become pros at that. And then they get this muscle density that is heavy. So they're probably not going to be 150. They're going to be maybe 160, 65. But they look exactly what they were envisioning. So that's your ideal body weight.
That's great. Yeah, and speaking of, weight management and ideal body weight, GLP-1 medications just continue to grow in popularity. So, I'd love to hear from your perspective, as a nutritionist, what is your, role in, either recommending or including GLP-1 medications in your patient's health? And how do you see GLP-1s and longevity? Because one of the things that people don't talk about enough is that when you take GLP-1s, you actually lose fat and you also lose muscle. So would love to hear your take on that.
Well, as nutritionist, my scope is not prescriber, so I cannot prescribe GLP-1 medications. I get tons and tons of people on those, and I'm very saddened because they just get the medication and they think that the medication is making them lose weight, which is not. It's what the medication is doing. The side effect is losing weight. So the first thing I try to instill to them is that this is a tool for you to manage whatever issues you may be having. And there's a lot of people that have sugar cravings, and so understanding where the cravings are coming from. And cravings can be mitochondrial dysfunction. It could be unhappiness. It could be just boredom. So people can use that, and I have been successful at that. People understanding that the usefulness for that medication. When they understand that it's just a tool, not a permission not to eat, because that's the other thing. So they start losing weight, bone, muscle, fat, and aging incredibly. I think I read somewhere that the people age decades when they don't do this the right way. So, and then after that is instilling in them the importance of protein prioritization and strength training to prevent that muscle and bone loss during this process. But the main thing is to understand that this is a tool. And besides that, the GLP have all these other benefits that we are finding out, cognitive and for cardiac health, or things that we don't know that. But it's not a weight loss medication, it's a tool to help you lose weight, if that makes sense. That's the way I see it.
Yeah, definitely. And, talking about something that we started talking about in the beginning, I'd love to dive a little more into the relationship between physical strength and mental clarity. So, what's the physiological or clinical basis for this link, and how do you support both of those?
Well, the main thing of physical strength, if you're physically strength, that indicates that you probably are metabolically healthy. And when you're having a lifestyle that is according to all that, so if everything is working as it's supposed to, you have an anti-inflammatory lifestyle, and that's the main benefit of having like a fitness routine, or having a fitness or exercise aspect in your lifestyle, and reduce inflammation. Resistant training is the best anti-inflammatory there is. Besides all those things, it's great for your cognitive function because you are releasing a lot of what I call the feel-good hormones, which is dopamine, serotonin, uh, endorphins. All those things also play a role in that anti-inflammatory processes in the body. Also, with exercise and having a strong body, your blood flow in general is better, and especially to the brain. When you have enhanced cerebral blood flow, more oxygen is going to the brain, more nutrients are going to the brain. That brain fog that people complain about dissipates in many ways, unless there's other conditions that they need to do that. Also, there's the release of BDNF, neurotropic factors that helps us live longer and improves brain plasticity, which is crucial for learning and memory. And then also, when you are metabolically healthy, your hormones tend to be balanced. So hormonal balance is another aspect of it. And the big one, which is the foundation of our energy production, mitochondrial health. There's a lot of metabolic conditions or that we experience, and the root cause is a mitochondrial health issues. So that is one of the biggest aspect of physical strength and mental clarity, mitochondrial health.
Great. So let's talk a little bit about functional nutrition. So, how do functional nutrition principles shape some of the work that you're doing with men? So, let's dive into fatigue, brain fog, and hormone imbalance. You talked a little bit about brain fog already, but would love to hear a little bit more about those three.
Well, having a low carb lifestyle will help you stabilize your blood sugars. I mean, one thing we need to understand is we are the same human being that lived many, many years, millions of years in the caves. So our genetic predispositions are basically the same, very little variations that happened since then. So we need to mimic that kind of primal lifestyle, which was eating whole foods, moving, sleeping with the sun, having a life, working during the day and sleeping at night, things like that. So when it is related to fatigue and brain fog, again, stable brush stabilizes the blood sugars. Inflammation management also. When you eliminate all processed foods and refined sugars and all those inflammatory oils, seed oils, um, and you follow a primal approach to health, it reduces systemic inflammation. Also, when you eat whole foods, as we are supposed to, real foods, nutrient-dense foods, your gut function tends to stabilize and have a balanced microbiome and all that. Then, when it comes to fats, having all those the healthy fats that we're supposed to eat, it will help you with your hormonal balance and nutrient density, which is the basis of this primal way of eating. Eating real foods will provide all the nutrients that we need, especially the protein, which is the foundation of everything, and then all the micronutrients, minerals, vitamins, vitamin D, cofactors, you name it. And of course, aids, all that will aid to keeping a liver that is doing its job properly because it's getting the right kind of information, the nutrient it needs to do its detoxification processes, and also reducing of stress. That is also a great reason to follow this primal way of eating.
Yes, definitely. And, when you already mentioned resistance training, but I'd love to talk a little bit more about, how you customize different kind of prescriptions for exercise or prescriptions for resistance training based on, hormonal or metabolic lab work that, your patients might be getting.
Well, from my perspective, the biggest metabolic condition will be insulin resistance. Some people will have testosterone issues, some guys will have testosterone issues. And then the stress. So related to that, you will tailor the intensity and the volume for hormonal testosterone. cortisol issues, you want to pay attention to intensity and volume. Uh, Low testosterone may need more recovery or specific training protocols. Uh, I have an example. I have 5 exercises, big, complex exercises, big muscles, everything. Don't skip leg days. Your glutes, your quads, your hamstrings are heavy promoters of testosterone production. So those kind of exercises will be beneficial. And then if you have cortisol, high stress, so you may be needing more recovery time and having better, helping you sleep better and doing recovery things, meditation, sauna, stretching, yoga, you name it. And then if it's lab related, A1C, insulin, again, the same thing. Um, just doing the variations between resistance training and cardio. I tend to prefer always resistance. And when you're doing heavy compound exercises, you're already doing your cardio. You release a lot of adiposity when you're doing that, and then you can do some 10, 15 minutes of a low pace, what is called a zone two cardio, and that will be enough to keep burning that fat. And when you do heavy exercise, that thermic effect will last you for days. So you will still keep burning fat over time, not just at the moment of exercise. And then if you have general inflammation, well, you need to pay more attention to the diet and um, cortisol also. A lot of issues happen that overtraining happens, so we need to pay attention to overtraining. Too much of a good thing is not better than just what you need.
Absolutely. So, thank you so much for your time. This has been such a quick session. So, as we wrap up, we'd like to thank Dr. Pucci for being our guest today and to MYOS MD for sponsoring today's Power Panel. Fueled by the revolutionary proprietary ingredient Fortetropin, MYOS MD is trusted by healthcare providers nationwide to deliver real results backed by science. So, if you'd like to learn more or hear more from experts like today, you can go to MYOSMD, MYOSD.com to learn more. All right, so one final question, just summing everything up today, if you could leave the healthcare providers who are listening in, whether they're listening live or to the recording, with one key insight about supporting men's muscle, metabolism, and mental clarity, what would it be?
Protein. Protein will be the key. That's the major thing that I see lacking. Protein intake, recovery, and stress management. That's the other one. Uh, the stress management is huge because it's multifaceted. We think of stress like the bills or something that happened, but there's an underlying stress, the daily life things that we don't pay attention that is also affecting our hormonal function. So those are the two major things that I always pay attention to.
I know I said that was the last question, but since you brought up stress, I wanted to ask quickly, what are some of the stress mitigation strategies that you generally use? What are your top, let's say one or two go-tos?
Well, believe it or not, they're saying there meditation. I happen to have not such a good relationship with meditation. So I talk to people what meditation will be. It could be meditative state. It could be artistic expression, sitting down in front of an ocean and watching the sunset. Uh, Sometimes I help people that work in front of desk jobs, isolated. Binaural beats are fantastic. Square breathing is another uh, good way to release stress, and of course, resistance training. Those are my major approaches to stress management and
Yeah, I love
family.
that. Yeah, I love that most of them that you mentioned are free to very inexpensive. A lot of people overcomplicate stress management and they think that, oh, I need to go purchase this or use this, but almost everything you mentioned is free. So I love that. Yeah.
Yeah, no. Even the binaural beats, there are thousands of those on YouTube.
Yep, that's how I use them is through tube. Yeah.
Great.
All right, incredible. Well, thank you so much again for being our guest this week for our
My
session.
pleasure.
And if anyone would like to learn more, please do not hesitate to reach out to either of us. All righty. Well,
Thank
thank you
you.
so much.
Yes.
Have a good rest of the day. Bye-bye.
Ciao. Thank you.
All right.
Should I say goodbye?
Yeah, I'm trying to end it right now.
Okay.
Let's see. It should be ending. Okay.